Hello, my name is Shomnath Mookherjee. I'm an associate professor of medicine at the University of Washington School of Medicine. And today I'm happy to talk to you about how to write a case report for fun and academic profit. If you're interested in writing a case report, thinking about how to put one together, this will hopefully be a really helpful talk for you today. So let's start with why even write a case report? Well, one of the most important reasons is that it's the right thing to do. There are many clinical cases and many syndromes that have been defined primarily through the publication of case reports, and a couple of examples are given here. Parkinson's disease and recognition of the emerging syndrome of AIDS, and many other examples are a result of publication of case reports. Other reasons why a case report may be a good idea include opportunities for mentorship. If you're in a promotion track where publications are important, case reports are academic currency. They can be listed in your CV as peer-reviewed publications. Writing a case report is often an opportunity for collaboration. And finally, I personally have a lot of fun writing case reports, and maybe this is a good motivation as well. The three objectives today: to use 5 questions to help assess the suitability of a case for a clinical vignette, following key steps in preparing a clinical vignette, and finding an appropriate journal for your case report. And I should mention here that as I talk about case reports today, I'm really referring to a stepwise process of finding a case, usually writing it up as an abstract or a clinical vignette for a professional society meeting, and then taking the next step to publishing it as a case report in a journal. So as we get started here, think of a time that you said we should write this up in reference to writing up a case. So as you reflect on a potential case, let's go through 5 questions that'll help you decide whether your case is an appropriate one for publication as a case report or a clinical vignette. The first question is there a diagnosis? The second, third, fourth, and fifth are listed here as well, and we'll go through each one of these one at a time. So starting with, is there a diagnosis? This is probably the one question that you need to really have an answer for. There should be a diagnosis. It's really not likely that a case report will be published if at the end of the case report you say, and the diagnosis remains unknown. Sometimes though, variants of known syndromes or a new syndrome can be published as a case report, but there must be a rigorous workup if that is the case. An example of a case report that was published without a 100% clear diagnosis is shown here. So the authors here describe a possible new MEN mutation in a patient who really looked like they had a MEN, but the usual mutations were not detected by PCR assays. So they stated that this was a possible new multiple endocrine neoplasia mutation. The second question is the topic something strange, rare, or is it an uncommon presentation of something that's strange or rare? So I won't go into detail about question number 2, because this is typically what provokes the idea that perhaps this would be a good case for a case report in the first place. If it is not strange or rare, the topic should at least be an important clinical issue. So an example of that is shown here. This is a case report of early repolarization masquerading as ST elevation MI. So this is obviously a really common scenario where we look at EKGs and say that, oh, that's not a ST elevation MI, that's early repol. But it's important enough, even though it's common, it's important enough to merit writing it up as a case report. The fourth step is, if it's not strange or rare or uncommon, and if it's not that important as a clinical syndrome in itself, is there a diagnostic, therapeutic, or management dilemma? Dilemmas are really interesting for folks to read about, and oftentimes a dilemma can serve as the basis for a good case report. So here are a couple examples of dilemmas. This is one in which the authors state the main diagnostic challenge was differentiating between impending paradoxical emboli and biatrial myxoma. And so this was a straddling interatrial embolus, and they wrote about how they manage this and the dilemmas and how to manage this well. The second example I'll share is in the pediatric literature. This is a dilemma of the pros and cons of early versus delayed intervention for definitive repair of the ureter in a patient with juvenile polymyositis associated with ureteral necrosis. So this is obviously kind of a niche dilemma, but a dilemma nevertheless, and certainly merited publication in a peer-reviewed journal. So the last question you should ask yourself is, even if it's not particularly strange or rare, or if there isn't necessarily a dilemma, is there at least an important teaching point associated with your potential case? So the example that I give for this important teaching point is loss of guide wire in someone placing a central line. Guide wires are lost quite often in placing a central line. And I think the incidence is on the order of hundreds of times a year. So it's not an uncommon occurrence, but it's important enough that it merited writing up a case report, as was published here. So I asked you to consider a potential case that you might write up and think through these 5 questions. So if you would like, take this opportunity to pause the video and think about your case. Do you think this would be an appropriate case to write up on the basis of these 5 questions? Moving on. Next, I'm going to talk about 3 key steps in writing up a case report, first as an abstract, as I said, and then potentially as a publication. And I divide this up into 3 key categories. You'll thank me later: inpatient tasks, getting the ball rolling, and being a good mentor. So the 2 sub-steps under inpatient tasks are listed here: consent and gathering data. So it is really, really critical that you get consent from the patients while you have access to the patient. If you're in an inpatient scenario, and even in an outpatient scenario, folks will often get lost to follow-up. So I really can't overemphasize the importance of getting consent. And different journals will require different types of consent or evidence of consent. So it makes a lot of sense to use your hospital forms to get consent, even if you're just considering writing up a case report on the patient. So I'm showing here a couple forms from our institution that we use to get consent for case reports. And this is a second form. There are often 2 types of forms. One is for publication of a patient's medical history in the form of a case report, and the other is to share images. It makes sense to get both of these consents taken care of, so that if you do want to share images from radiographs or something else, then you have that consent taken care of as well. This is a consent form from BMJ Case Reports. They have their own case report for consent form. So I'm sharing this here for a couple of reasons. First of all, BMJ Case Reports, I think, is an excellent venue for publishing case reports. And if you do decide to target their journal, you'll want to use their own consent. And then secondly, it makes sense to look through different journals that you might be targeting as a venue and see what each of the journal's individual consent requirements are, so that you're prepared ahead of time. The next key inpatient task is to gather data and images as soon as you can while the patient is still inpatient. So, for example, intraoperative images, pictures of your patient, and sometimes with some sort of a maneuver as shown in this picture here, maybe using a ruler, maybe taking a video of a particular finding. While the patient is still in the hospital is typically the best time to talk to the pathologist, talk to the radiologist, talk to the surgeon, and gather the images and information that will be most salient for your case report. And then finally, although most hospitals now are using completely electronic medical records, sometimes the paper chart will still have some records that are not easily attainable in the electronic medical record. For example, at the University of Washington Medical Center at Montlake, at least for some time, the nocturnal oximetry records were just being placed in the paper report, in the paper chart. So the next key step here is to get the ball rolling. And the important steps here are determining authorship and responsibilities and setting deadlines. So I'll go over these briefly. It's really important to help make a good team from the very beginning of the case report writing effort. So keep in mind that even if this is a patient that you may have been primarily caring for, other specialists and subspecialists may feel like they have been very involved in the case and potentially may have even made the diagnosis. So be careful not to step on any toes and consider inviting other specialists and subspecialists to be part of the authorship team when appropriate. Think out of the box in terms of collaborators in putting together a case report. Perhaps the pathologist might have made the diagnosis or had a critical contribution to making the diagnosis, and it might make sense to invite the pathologist. Similarly, a radiologist or even nutritionists, physical therapists potentially, or if there's a toxicology team involved that help make the diagnosis. So think outside the box. It's really critical to define roles and authorship upfront as you put together your case report. So for example, the first author is typically responsible for completing the literature review, the first draft of an abstract and poster, and presenting the poster. The last author is usually someone who's had some experience in writing a case report, presenting a case report, or putting an abstract together. And so the last author is typically responsible for confirming the literature review and then essentially polishing and verifying every aspect of the write-up, including the abstract and the poster. Middle authors have an ancillary role, such as aspects of the literature review, obtaining images perhaps, editing abstracts, definitely contributing enough to merit middle authorship. It's important though, as you invite middle authors, that they are able to stipulate to being able to turn around anything that they need to give input to in a timely fashion. So here's an example of an email that you might send to help make a team. And this is a hypothetical case report on a patient who had sniffles after using grape-scented boogie wipes. And so imagine that you are the attending and you're writing to the resident. This note is to follow up on the patient we had discussed writing up while we were on service together. Remember the patient who had intractable sniffles after using grapes-scented boogie wipes. Are you still interested in submitting this as a clinical vignette abstract? And hopefully submitting a case report for publication. If you are interested, I would be happy to be your faculty member for this submission. So this part here is key. It's stating responsibilities and deadlines. And I'll read this aloud. I propose that I would be the senior or the last author. I will confirm the completeness of your literature review, edit and help finalize your draft of the abstract, help keep you on track with deadlines, and help you with making your poster and practicing your presentation. You would be the first author. You would perform a literature review, write the first draft, and make and present that poster if accepted. So this is an example of how to communicate, delineate authorship responsibilities, tasks, and deadlines. And I think it's really important to have this in black and white. And so, for example, this might be a timeline that you could use to determine how to actually bring this sort of project to completion. And I'll leave this on the screen for a minute. I won't go through each of the rows and columns, but this gives you an idea of what the tasks are, who is to perform the task, by when, and what the next steps are. So your timeline doesn't need to be this granular, but the point is, without a timeline and deadlines and tasks, it's unlikely that your clinical vignette or case report will be completed. The last key step here that I'll go through is being a good mentor for a case report. And so the key components are listed here. And so let's start with the literature review. It's really important for any case to define the parameters of your case and how it fits into the published literature. For example, how many times before has your case been reported in the literature? And if you have a very broad case, you may need to narrow the parameters if necessary. You can count up individual cases, then look at case series and look at the reference list of case series, and that will help you add up the total number of cases that have been reported in the literature. Sometimes you do need to narrow your case. For example, this is a case report that I was involved in on MSSA brain abscess and pyomyositis, presenting as brain tumor and DVT. So pyomyositis and pyomyositis due to Staph aureus are very common. Hundreds and hundreds of cases of this have happened over the years and been published. In patients with diabetes, it actually is particularly common. However, this syndrome is most common in tropical climates. In temperate climates, it's less common, and so the numbers are starting to go down. And then in folks with pyomyositis and a brain abscess in a temperate climate, for this particular case report, the answer was 0. This had never been reported before. So this example illustrates how you might narrow down the number of prior publications of your particular case. So here are a couple more examples. The top paper there is the first report of a patient with insulinoma presenting with cardiomyopathy and VF arrest. And then on the other hand, the second bullet point there is a case report that had been, that reported a case that had been reported at least 28 other times in the past. But nevertheless, this case report was still published because it was such an important topic and syndrome. Okay, so the next step here is to encourage your mentee, or perhaps just encourage yourself if you are the first author, to just write something down. And so the first step is to look at the professional society parameters for how they want a clinical vignette abstract submitted. And again, I have a bias towards starting first with the clinical vignette abstract and then moving forward to a case report. And so once you know what these section titles are, you can just start writing something down. Just imagine that you're telling the story to an interested colleague. Really don't worry at all about style or what information is missing or what level of detail that you should be using. Just start by writing using those subtitles, and then use resources like a colleague or maybe a mentor to help you edit and revise. So in the key points in putting a poster together are do not cut and paste your abstract. Make bullet points to illustrate the key parts of your abstract and minimize the amount of text. Certainly there should be no full paragraphs, just bullet points describing, for example, here, the history of presenting illness. Again, illustrating that the key events and key points should also be presented in bullet points. To the extent possible, use graphics to make your poster visually interesting. And then conclude with 2 or 3 main teaching points that are also bulleted. So those are the 3 key steps that I recommend to actually start putting together your abstract, clinical vignette, and eventually case report. So thinking now about the next step and publishing it as a peer-reviewed case report, it's worth thinking about what sort of format you would like to submit it. The 3 major categories of case report formats are images, vignettes, and clinical reasoning papers. And all of these have pros and cons. Images are presentations of EKGs, maybe radiology findings, physical exam findings. They're usually much, much shorter than the other 2 categories and typically less work. But cons are they typically allow fewer authors and the discussion is usually quite short. Case reports or case vignettes usually include a review of past cases, some sort of discussion of why your case is unique, and a discussion of implications for clinical practice. If you've already done an abstract for a meeting, it's usually not too much extra work, but it is extra work and it may not get published because it's sometimes challenging to get case reports published. A clinical reasoning paper is a diagnostic approach to sequentially presented information. So these you may have seen in the Journal of Hospital Medicine, in the Journal of General Internal Medicine, and the New England Journal of Medicine. And the commentary of each case segment is integrated throughout the paper and it ends with a discussion. These are usually lots of fun. The audience that reads these is usually a lot bigger than a case report. And it's a great opportunity for collaboration with clinical reasoning experts around the country. But the cons are that it is actually lots more work and it may not ultimately get published. So as you think about what type of case report you'd like to write, you can start thinking about your target journal for publication. And the box here has 5 things to think about and look through in the criteria for different journals for case report publication. Some limit the number of authors. Some have different criteria. For example, they will say that they will only publish a case report if it's the first time that syndrome has ever been recorded. There are limitations on length and different format requirements. And finally, some journals do have hidden costs, such as increased publication charge for color photos, or even publication charges to publish your paper at all. So I start by thinking about looking at the highest impact journals, then looking at the next level of journals, which can be regional, specialty, and subspecialty journals, and then finally looking at other publication options. So here are some examples of case reports that are published in high impact journals. And you can see that the titles indicate that these are not necessarily first time ever type case reports for these high impact journals. And you can see that the number of authors that are allowed for each of these journals tends to be on the low side. Subspecialty journals can be overwhelming in number and in scope. This is an example of some subspecialty journals in gastroenterology. And this actually goes to 3 pages of journals. And the only way to tell if they publish case reports is to look at each journal homepage, read through the journal itself, look at their instructions to the authors, and see if they would be a good target for your case report. Finally, other options include pay-to-publish journals. Some of these journals are actually not that reputable or are only trying to make a profit. Others are actually good targets for publication. And among these, I think BMJ Case Reports stands at the top. They state that they want to publish cases with valuable clinical lessons. It is essential that the learning outcomes of the articles are important and novel. They have a charge of something around $400 to $500 a year to join as a fellow of BMJ Case Reports. And that gives you access to all of their case report publications and an unlimited number of submissions a year. I have published with them, and I'll endorse that their peer review process is quite robust, and they will have extensive critiques of your submission, so it's not an automatic publication. And other non-reviewed, non-peer-reviewed potential publication targets include SGIM Forum, ACP Hospitalist, or the Hospitalist. And if you're not able to get your case report published in a peer-reviewed forum, these may be appropriate places to publish your case report. So in summary, I recommend using 5 questions to assess the suitability of your case for publication. Follow the key steps that I outlined in preparing a clinical vignette. And find an appropriate journal for your case report. 5 steps, again, are listed here. Is there a diagnosis? That's the one step that you really need to have. You really need to have a diagnosis to publish a case report. Is the topic something strange, rare, or an uncommon presentation of something that may be more common? If it's not strange or rare, is it at least a really important clinical issue? Is there a dilemma? And failing all of these, is there at least an important teaching point? The take-home points are: get consent, establish authorship, set deadlines, edit to tell the story, and consider specialty journals.